Hi, I'm Jason Austin. I'm an assistant professor here at the University of Louisiana at Monroe in our marriage and family therapy programs. And we appreciate you clicking on our video today. We're going to be talking about systems theory. And it's a topic that all three of us are passionate about. It's the foundation of family therapy in general as a profession, what started our profession and how we intervene with family problems and couple problems that people present with in our clinics. And I'm passionate about it personally for my sake, because it has been, as our field has grown since the 1950s, people have grossly mischaracterized this theory. I would say, what, in the past 20 years? Past 20 years, people have really misunderstood how to apply systems thinking, dressed it up as something it's not, and have stripped it of context in the way that it can be used for family problems. And I think because of this, a lot of times it's not being taught in many marriage and family therapy programs, and when students graduate from these programs, oftentimes they don't have the clearest understanding about how to intervene with a problematic family in the therapy room. And this is, I don't know how you two gentlemen feel. To my left is Dr. David Hale. He is our online program director, and he is the associate program director.
Right.
And an assistant professor as well. And to my right is Dr. Wendel Ray. He is the Spiker Endowed Chair and Professor of Family Systems Theory here at ULM.
As Jason said, I'm Dr. David Hale. I've been at the university for about 3 years, but I've been a systems zealot for going on 30 years. And I second everything that he said. And part of the reason we wanted to have this conversation and present this series of work is because a lot of us, we get questions all the time. Well, how do you work with this particular presenting issue? Or how do you work with this presenting issue? And one of the things that we understand, there isn't a lot of improving videos, YouTube and that type of thing. There isn't a lot out there that represents what we do from a systemic perspective. And so we decided that we wanted to put together this series of, and it's going to also illustrate the approaches that we use in our master's, CONFT accredited master's and PhD programs here at the University of Louisiana Monroe. We're going to do a series, we hope to do a series of kind of how to work with ADHD, how to work with, you name the presenting issue, so that way people will have kind of an understanding. It's not going to be an end-all, be-all to end-all. However, we think that it'll be informative enough to where you'll be able to take what you observe and probably use it in your own practice. I know that the first part we're going to cover is going to be the theory. One of the things that we all understand is that it's neat to read the textbooks and find out all the techniques, but then if you don't have an understanding of how those techniques come into play, then it really doesn't work, maybe. And so we're going to present the theory, some of the tenets of systems theory, of the communicational theory, the interactional view, that will kind of guide you as to make sense of what comes further in the other segments about how to work with this issue. So I turn it over now to Dr. Ray, who's going to talk a lot more about the theory.
Thanks, David and Jason. What I'm going to try to outline today in this first of the series of tapes is in essence, the basic presuppositions of interactional theory, or that is a systemic approach, and based in predominantly in the research that came from the Palo Alto group in California in the 50s and 60s. I want to begin with a quote of George Orwell, who said, "To see what's in front of your nose needs a constant struggle." And the interactional view is dedicated to helping us see what's happening right in front of our noses in the current moment of interaction. So the work of the Palo Alto group, which was led by Gregory Bates, a cultural anthropologist, Don Jackson, a psychiatrist, John Weakland, a chemical engineer and anthropologist, Jay Haley, who was a communication analyst, and another psychiatrist, William Fryer, were the principal members of that group in the 50s. Took cultural anthropology methodology and combined it with Harry Stack Sullivan's interpersonal theory, and through those two perspectives, or allowed themselves to be informed by those two perspectives as they went about looking at what was going on right before their nose. And so that and then ended up with probably the most important presupposition of interactional theory, and is that it's a serious shift of data from what's going on inside of people, as though that's separate from what's going on right now between people, and what's going on between people in the present moment, that if you have the skills to see it, makes clear immediately what's going on, out of which problems or not problems emerge. And so that shift of attention, that intentional shift from what's happening inside to what's going on in the moment between, is the first presupposition of the interactional view. There's a shift in primary data, and we mean it. This isn't to say there aren't things going inside of us. Of course there are. Mm-hmm. But what's important is, where do you focus your attention, right? Because if I'm busy trying to think of what's going on inside of me, which is a legitimate theory, it's a legitimate point of view, it pulls you away from paying attention to things that if you're not observant, you're going to miss in terms of what's going on right now between people. And that does not only include, in a first order way, what's going on between them, so the therapists, the clients, as though I'm not even in the room. That's first order. And second order, and it's at both and, it's not an either or, to include the clinician, because you're in the room too. This idea of shifted primary data, of really taking seriously that you see a different world if you pay attention to what's happening right now in front of you between people, in contrast to thinking about what's going on inside this person that's making them behave this certain way, and that you're a human too and you happen to be in the room too, are important. Mm-hmm. The idea of context. Everything is context contingent. This is a context contingent view. In order to be able to comprehend and attribute meaning to whatever it is people are doing and saying. We had a student yesterday in class talking about this young boy who was 8, who presented with, who was scaring the heck out of everybody, because he was saying that he was thinking of killing animals and he was thinking of killing himself, and people are just thinking, oh my word, you know. But immediately upon inquiry, getting closer to asking questions like, what's going on? What do you mean? You know, who's there when this happens? It became evident that this boy really was making some pretty brilliant, unlabeled metaphoric statements about the reality he lives in. A small house, 1 bedroom that his mother and his grandmother and he has to share. Another bedroom that's been relegated to where the cats live. Now, to me, this little boy, who one could pretend is hallucinating, isn't hallucinating. He's just being as straightforward as one could be. That is the difference in what comes immediately emerges in clinical work when one listens attentively to what people say.
Expanding the context, asking questions to find out the larger.
And taking into account that if everything's about who am I in relation to you, that it's as though everything is being said, it's me saying, this is who I am in relation to you. One of the basic presuppositions in our world is reporting command. Mm-hmm. The difference between reporting command is, this is a chair, everybody agrees, that's a report. Me saying it to you, in effect, is saying it's an important thought about who am I in relation to you.
Right.
Taking they're really there are not that many, but together, it's an incredibly valuable way of thinking about who you are in relation to the other in the moment.
Yes.
Plenty of literature out there that at the end of the tape will give you a list of places you can go if you want to know more about this. But let me say a few more things about the theory. We pay attention to punctuation. The punctuation is the attribution of meaning each person gives. The example, the classic example, is an updated classic example, is somebody looking at their device and so absorbed in it at the breakfast table, and the other person being irritated because we can't even have breakfast together without you looking at that more than me, right? And then the guy or girl who's looking at the device says, "Well, I look at the device because you're driving me crazy. You know, if you would just back off a little bit, I wouldn't have to put this thing between you and me as a shield." That person is attributing causal meaning to the other. The other is attributing causal meaning to that person, and an observer, if they've got the eyes to see it, can see how the two of them are escalating, feeding one another as out of behaving as though their action has nothing to do with the trouble. That's punctuation. And it's a very important idea. Yes.
Another example, or using the same example you started with about the 8-year-old boy, punctuation could also be that the mother comes in and says, "My son is hallucinating, he's delusional, he's this." She's focusing on this behavior that when you expand the context, you find out that there's more to it. She's punctuating this piece that you then expand upon in the effort to expand the context. Now all of a sudden you find out that the behavior is kind of making sense because he's speaking about what is really happening in his situation.
That's exactly right. These ideas have profound relevance for the techniques that emerge out of this way of thinking. Like, how can I listen to what's going on in a way and then respond to it in a way that you can gently reframe the behavior that has been presented. One could talk about one could negatively characterize the mother quite easily. It's easy to do. Or one can say, this is a woman doing her very best under very tough circumstances, who's very concerned about her child. Her child is absolutely concerned about his mother and his grandmother. How can I bring this to the attention of other people to help us get out of this snag in a way that's not going to put my mother on the spot, put my grandmother on the spot, you know? And the mother the same way. And so the idea of listening attentively, taking what you're hearing and using the style of talking or the alarm that the mother might be conveying as a way of positively connoting, which is another one of the major instruments that we use as an intervention, is positive connotation. Not the only one, but is positive connotation, so that people can breathe and they're not caught up on the idea that they're going to think that I'm a bad mother because my son has this trouble, unless it's a biological thing that's beyond my ability. So these are really important aspects of how we go about being human beings in the presence of other human beings, right? Which is really what this is about.
Oh yeah.
So punctuation, we pay real close attention to how people qualify what they say. You know, so just using the example that we heard in class yesterday of the presentation of this 8-year-old who's hallucinating, wanting to kill animals and wanting to kill himself, and the mother taking the initiative of seeking out help. Well, that's a loving thing. That's a tender thing on her part.
Right.
How do you approach someone like that without, in how you approach it, eroding her own sense of who she is and putting her further into some experience that we are actively avoiding of blaming her. Blame is not that's not one of the precepts of of interactional theory. It's not a precept
Right.
of systems logic. It is a precept of some other points of view, but not this one. And so,
Because if she's doing the best that she knows how, then she's doing what is the right thing to do.
you just brought up one of the other, that's two or three from. But
Sorry.
one of the main one of the main
Follow my
presuppositions
lead.
Yeah.
one of the main presuppositions of this point of view is a non-pathological, non-normative way of thinking, and we mean that. It isn't just sometimes with certain symptoms. We merely mean it. We don't see things from the not that there isn't value in seeing
Right.
things from a pathological viewpoint,
Sure.
legitimate viewpoint. That's not the point of view of something that's both first order and second order cybernetic. First order being what's going out there between people that I can see as though I'm not involved.
Right.
Second order, I'm involved because it's my eyes and it's my interpretation that's being described, that's describing. And it's always both end and has been since the early 50s when these people, they're not old guys, started working together. So I just want to read a quote that, and I apologize for that, not really, because it's from people who have rare access to it. It's from 1952 of Don Jackson's regarding what is the non-pathological, non-normative view, right? The individual does the best he can at any given moment. Terms like lazy, stubborn, no willpower are not merely descriptive. They imply a moral censure and an unspoken he could do better if he wanted to. Hence, certain dynamic interpersonal processes over which the individual has no control are responsible for his character traits. That's a stunning conception, and it is foundational to our work. It's not the only presupposition that's foundational. But they take quite seriously that we are literally doing the best we can given the constraints of the situation and contexts of which we are a part, right? So, thanks for skipping ahead.
Right.
It's obvious that this is a circular or recursive causality, not a linear causality. There are certain presuppositions that are basic to the interactional view, such as family rules.
Oh yeah.
People that live together, some of whom are in constellations that one would call a family, if you're together as a group for any period of time, you behave amongst yourself as though, almost as though, you're following rules. That over time, if I watch you, I'm going to notice that out of A, B, C, D, E, F possibilities, you only do A, C, and E over and over again. And out of that redundancy, that pattern, one way of describing that pattern, it is as though we are following rules. It's a very useful, it's not the only tool in the kit, but it's a pretty doggone good one if you take it seriously. And then you can behave. Therapy becomes quite simple in a way. It becomes get the rhythm of that, act in a way that rhythm cannot continue. That, in a nutshell, is brief, systemic, interaction-focused therapy. I'm almost done. I'm almost there. We got both banned. It's real important to pay attention to how you speak, because usually you believe yourself, and other people might think you mean it. So we actively practice shifting verb tense from to be to seem. That's the way it is. That's the way it seems to be from the point of view that I'm looking at it from. Now you might say, so what?
Makes a difference.
Go to bed and think about that one, because that's a biggie. Okay.
Well, it's the difference between something definitive and something that's a possibility.
And can't be changed.
And can't be changed.
And if it can't be changed, well, maybe medication is the only
Right.
legitimate approach,
Right.
or deciding that there are limits that one will never overcome.
Not to mention, it's far more humble when you're with your client.
Taking a to seem
Yes.
point
Yes.
of view. Absolutely.
Yes.
Absolutely. Let me tell you what, the kiss of death in life is arrogance or hubris. And any number of people have written about that in our discipline. Sullivan certainly wrote about it. The Milan people certainly explicitly, Milan Systemic Family Therapy, Palazzoni, Boscolo, Chakeen, Prato, read explicitly discuss that. And they see themselves as direct lineage, indirect lineage to the Palo Alto group, as do probably 70%
Right.
of the models. Let me say one more thing. And obvious, it's so obvious now that we are sitting here speaking, but it isn't obvious at the beginning that whatever we call reality is constructed, that we're part of it. That is a scary and an absolutely wonderful idea if you embrace it.
It's free.
Because that means anything can be changed.
Yeah.
And so hope is involved and possibilities are involved. So the only thing I have to say now, and David really spilled the beans a minute ago. Here, the last tenet I would say in this is, what does all this mean? What is it? How do we put this theory to work? And I have 5 things that I think we do routinely. If that way, and we certainly teach here in our masters and both PhDs at the face-to-face and online. We have 100% systemic studies online program. So here are 5 things. One is promote, and the 1, 2, 3, 4, 5 is arbitrary. Number 5 could be number 1.
There's no hierarchy.
Exactly.
All right, okay.
Promotion of insight was recognized as not consequential. We're not in the business of trying to give people to see it better in order to be able to behave differently. That is a legitimate point of view from people I greatly respect. Virginia Satir comes to mind as an example. We, in turn, as distinct from that, followed people like Hans Van Forster, Paul Václavic, where they said, in order to see, act. And the moment you take that point, that's the opposite view. It isn't that it's there and I have to figure it out.
Right.
It's me that's attributing that. Move, take action, and lo and behold, you have a different reality emerging just right out of that. And so this idea, and it's a big one, you're promoting, getting things to change by getting people to understand through insight is from a different theory now. Number 2 is reframing replaces interpretation. Interpretation implies that's the way it is. You know, you are the way you are because your mother dropped you on your head when you were 3. And it's ever since everyone knew, and now I'll prove it, right?
Or you didn't attach well early on.
Yeah.
Well, my description was that without using that
Right.
A word,
Yeah.
that is so popular
Yes.
now, the attachment word. The difference between injunctive and descriptive language. It's important to describe what's going on without attributing meaning. And equally important is be able to tell people what to do. Don't be shy about giving an instruction intentionally for the purpose of seeing what happens when you give this instruction.
Right.
Now, they may say, I'm an adult, you don't give me instruction. But that's important because now you're more informed about whom it is you're speaking with, and you go forward based on that. You follow?
Yeah.
So the idea of, and I spend some good bit of time talking about the difference between injunctive and descriptive
This
language.
follows the idea that treatment is circular, not linear.
Oh man, this is such an important idea.
Yeah.
This when we say we're not linear, we're circular causal.
Right.
Oh yeah, I've heard that.
Right.
But that's exactly right. If we were acting as though the world as you're going to experience it is relational, circular, and anything I do is always informed and a little bit shifted, changed by how the other is behaving,
Exactly.
and then that's going in a circle. But the capacity to behave differently in a productive manner can come from that. We give indirect and direct behavioral tasks.
Oh yeah.
And we're not, and then what's even as important is we follow up. Don't give a task unless you're gonna next time find out what happened. And what ends up you'll find immediately is even if people say, oh, we didn't even think about it. If you talk, you'll find that they did it in some form, some fashion, some
Right.
way. And now you're even more informed because this approach is information driven.
Yes. Well, it provides information. Regardless of what they do, it provides information, so there's no right or wrong whether they do it, or say they did or didn't do it.
That's right.
That's right.
It's a commitment to the treatment process. You don't just commit to interventions. You have to see how the family has taken those interventions, how they played out at home, and then that's new information that feeds back into
That's
the
beautiful.
treatment.
Back in, yes.
Because
Yeah.
another thing that comes, we could spin from this like all day,
Right.
you know. But one thing that comes from that is accountability.
Yes.
You're not just saying it's your problem, your fault, you're responsible if you don't get better. My finger's in this pie as a clinician,
Right.
and so this is mutual accountability that I heard when Jason,
Yeah.
when you were just describing that. The final one of the five, which we've already mentioned, is positive connotation. Being able to experience and then interact in a way that underscores some positive, some good, some value to what people are doing is an essential component. And that really, you know, obviously there's more we could
Oh, yeah.
discuss, but that's an overview of some of the presuppositions.
You know, the nice thing about it is that throughout the series, these ideas that you talked about that may not be clear yet to some folks
Right.
are going to be played out. And it's going to start to make more and more sense, the how-to, about the recursion, about the non-pathology talk, about the intervention possibility and how people respond and that. So it's going to be interesting to see how it plays out in the future.
I certainly appreciate you reading off those suppositions. It's been my experience when I've read critiques of systems theory. The authors of those critiques oftentimes, and this is important because you read off theory, and oftentimes the authors critique the way that theory has been practiced with their experience. So they've seen the way that systems theory characterizes power or how it leaves out certain characteristics of families. That's how it's been practiced incorrectly, I would say. But if you stick to theory, if you're sticking with those presuppositions and you embrace them, and the way that you go forward with treating families and couples, you're not going to have those issues that people have critiqued. Well, you mentioned attachment theory, and one thing I want to say for the record about the interactional view and other systemic approaches is just how compatible they are as a both and theoretical approach. Attachment is negotiated through interactions between parent and child. How my mom interacted with me when I was an infant influenced my attachment. If you're working from any perspective, no matter how you're examining a relationship, no matter what meaning you're attributing to it, taking such a stance is still compatible with that examination.
One of the things that I think has become tenuous in our field, it's not lost, but it's not what
Sure.
it once was the openness to other points of view that pervaded the work in the early years. Attachment theory methods that based on attachment theory, they're perfectly legitimate points of view. What I would say that in addition to them being legitimate points of view, there is the interactional view that came from the Palo Alto group that isn't attachment theory in any stretch of it. But they certainly can live side by side and
Correct.
inform one another. I think it is in the interest of people learning to have some clarity as to what is and isn't this or that. You know,
Sure.
but there's other points of view we haven't touched as well. But that's what I would say about attachment. It goes back to a basic presupposition of non-pathology, non-normative. That isn't just some theoretical. That means, you know, if you're an attachment person, rock and roll.
Right.
What brings you here?